Hello, my name is Sarah Beth Callahan, and I'm a PTA student at Jefferson. The patient that you are going to observe me treat is a 24-year-old female presenting with a traumatic brain injury after a motorcycle accident. The patient was found to have a left frontal laceration with a linear skull fracture. A CT scan revealed edema, a left frontal contusion, and a right basal ganglia contusion. During her acute hospital stay, the patient had increased intracranial pressure and severe spasticity. Then 4 weeks after the injury, she was transferred to a rehabilitation hospital to receive intensive therapy. She had a brief readmission back to acute care due to hypothermia and hypothyroidism. She is now back at the rehabilitation hospital and is 12 weeks post-injury. My patient has a good social history, for she is a young physical therapy student studying at a local college. She has very supportive parents who live 2 hours away, and her mother has taken time off to be with her during her rehab. My patient is functioning at a Ranchos Los Amigos Level 7 automatic appropriate and shows minimum to no confusion. She shows carryover for learning, but at a decreased rate. The patient is dysarthritic and speech can be difficult to understand at times and delayed. Auditory comprehension is good. The patient presents with some spasticity, exhibiting flexor tone in the left upper extremity and extensor tone in the remaining extremities. The patient's strength is grossly fair and fair plus. The patient displays fair standing balance, static and dynamic. The patient is able to perform bed mobility with supervision. The patient requires moderate assistance for sit-to-stands, stand pivot transfers, and for ambulation. The patient is able to perform self-care activities such as dressing and grooming with minimal assistance. The activity limitation that I chose to focus on is the patient's ability to ambulate with the least amount of support. As of right now, the patient is unable to safely and independently ambulate without assistance. I chose this activity limitation because it will be important for her to ambulate safely in order for her to return to her role as a physical therapy graduate student. Addressing this limitation will be important for her to return to home and to return to PT school without requiring assistance. This will also be important for her to get to classes and to be able to work with patients in a healthcare setting. The two impairments in body function and structure that I will be addressing is decreased lower extremity strength and fair standing balance. I chose these impairments because they are limiting the patient from being able to ambulate independently. I chose to address lower extremity strength over other impairments because the patient needs good strength in order to maintain an upright posture and to independently ambulate against gravity and without assistance. Improving the patient's strength will also help the patient to be able to perform daily activities safely. I chose to address the patient's standing balance over other impairments because it is important for the patient to have good stability before gaining full functional mobility. Addressing standing balance is very important for swing phase of gait due to a narrow base of support, and to be able to maintain balance on uneven terrain. The intervention that I have chosen to address for decreased lower extremity strength is for my patient to perform dynamic reversals of the lower extremity PNF pattern D1. My patient will perform these PNF patterns in a seated position against resistance provided by the therapist on both lower extremities. I chose this intervention because it will work the patient in a position against gravity. It will also work to increase and improve the strength of multiple muscles in the lower extremity. This intervention also reinforces the patient to work on their sitting balance as well. The intervention that I have chosen to address my patient's fair standing balance is for my patient to perform rhythmic stabilization in a modified plantar position. I will apply resistance at the pelvis and in different directions. I chose this intervention because it will improve my patient's static postural control in a standing position, which is important for my patient to have for safety and for ambulation. Also, this intervention will encourage weight bearing through the lower extremities, which is important and good for proprioception. My patient will also get some weight bearing and approximation through her bilateral upper extremities while performing this intervention. Hello. Hey, Mary.
Hi.
Do you remember me?
I do.
I'm Sarah Beth. I'm a physical therapist assistant student, and I worked with you yesterday. So I'm with physical therapy, and I'm here to work with you again today.
Okay.
Okay, so before we get started, is it okay if I take this sheet off of you?
Yeah, I have my clothes on, so I'm ready to go.
You're all ready. Good. I like when my patients are all ready for me. All right, and I'm just going to make sure that your bed is locked. Yep, it is. All right. So what we're going to do to start off with is we're going to roll, and then we're going to get you sitting up on the edge of the bed, okay?
All right. Well,
so I know you've been doing pretty well with the rolling on your own, so I'm just going to kind of watch and be here to supervise you. So if you want to go ahead and bend your legs up.
all right.
Go ahead and roll one over. Good, to your right. Okay, good. Now, I'm going to help you sit up on the edge of the bed. And so let's go ahead and bend both legs for me. Good. And now, I want you to use your right arm to push down. And on the count of 3, we're going to sit up. 1, 2, 3. Good. Now, I'm going to lower this a little bit so your feet are all the way touching. Okay, good. Now, before we do anything else, is it okay if I put my gate belt on you for safety?
Yep.
Okay. Did you have a good night last night?
Yeah, I slept pretty good last night.
Well, good. Okay, so before we get started with our first activity, I'm going to work on that hand and kind of bring it out. So we really want this arm in a little bit of an extension and lengthened position, because if we leave it here, it's going to get really tight and stiff. So we're going to kind of work on that and address that first before we do our first activity, okay?
Okay.
So I'm just going to take you out of this position, and we're just going to move really slow. Give you a little bit of rotation.
I don't think it's as tight as it has been.
No, I don't think so either. Not from the first time I started working with you. Nice and slow. We're going to get you to spread those fingers good and get you to bear some weight through that. So,
Okay.
So I want you to stay in this position as much as you can, because we really want to try to encourage this position to kind of get out of this. And so we don't want to stay tight and stiff, so we want you to, as much as you can, when you're working on your sitting balance with OT, we really want you to weight bear through this left arm for me, okay?
All right.
Okay. So now I'm going to grab my stool and we'll get started here. Okay. So do you remember what we were working on yesterday with our legs? Do you remember that pattern I showed you?
I think so. I might need a refresher.
So remember we were lifting our leg up and pulling our foot up and in like that?
Oh, okay, yeah.
And then after we got it up there, do you remember what we did next?
We pushed, we went straight.
Yep. So then we straightened our leg and pushed kind of down and out. So that pattern we were working on, we were pulling our foot up and in, and then pushing our leg down and out. So we're going to do that again today, but to work on the strength in your legs is I'm going to be giving you some resistance, and I want you to still move through my resistance to help increase your strength, okay? So first, let's go ahead and see you do that pattern, okay, that we were working on. So pull your foot up and in. Good. Now push your foot down and out. Good. Now this time, let's try with some resistance, okay? Pull your foot up and in. Pull, 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 pull. Good. Now push your foot down and out. Push, 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 push. Good. Just like that. We're going to do this a couple times. Go ahead and pull your foot up and in. Pull, 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 pull. Good. Now push your foot down and out. Push, 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 push. Good. A few more times. Pull your foot up and in. Pull, 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 pull. Good. Now push down and out. Push, push, push. Good. Pull your foot up and in. Pull, pull, pull. Good. Now push your foot down and out. Push, push, push. 2 more times. Pull your foot. Pull, pull, pull. Up and in, up and in. Good. Now push down and out. Push, 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 push. Good. 1 more time. Pull your foot up and in. Pull, pull, pull. Good. Now push your foot down and out. Push, push, push. Good. Okay, you can relax. So how do you feel with that?
Tough work.
Tough work?
Mm-hmm.
All right, we'll give you a little break, and then we're going to do the other leg, okay?
Okay.
You did really good with that. We'll do the same thing on this side. Okay, you let me know when you're ready.
I think I'm ready.
Okay, so go ahead and show me that pattern again on this side.
You start in, right?
Yep, so pulling your foot up and in, almost like you were going to cross your legs. So you pulling your foot up and in, good. And then what was next?
Push.
Good. Pushing down and out. Good. Go ahead and do that for me. And then down and out. Good. Okay, now I'm going to start giving you some resistance, okay? Pull your foot up and in. Pull, pull, pull. Good. Now push down and out. Push, push, push. Good. Pull your foot. Pull, pull, pull. Good. Now push down and out. Push, push, push. Good. Pull your foot. Pull, pull, pull. Good. Now push down and out. Push, push, push. Good. 2 more times. Pull your foot up and in. Pull, pull, pull. Now push down and out. Push, push, push. Good. Pull your foot up and in. Pull, pull, pull. Good. Now push down and out. Push, push, push. Good. Okay, go ahead and relax for me. How do you feel with that?
Feels good. It's a lot of, the resistance makes it harder.
Good. And we're going to get your strength back in your legs so you can do some more activities like independently being able to stand better and get you back to walking so you can get back to class.
That'll be nice.
Has any of your classmates been by to see you this week?
One of them, one of my better friends have, Sheila, she came by and saw me and told me how classes are going, and she told me that I'd have to do a lot of studying when I go back.
Well, that's good. I'm sure they miss you in class.
Yeah, I hope so.
Oh, I'm sure it's not the same without you.
Yeah.
So before I get you standing up, I'm just going to tell you about our next activity that we're going to do. So the next activity we're going to do is we're going to work on your standing balance. And so we're going to get you out of bed, and you're just kind of pivot to this table, and I'll go ahead and show you what you're going to do. So you're going to be standing here, and you can have your hands spread out, and gives you some handheld support with the table. And we're going to work on holding this position, and I'm going to be kind of trying to move you out of this position, but you're going to work on maintaining this position. So that's what we're going to be doing next, okay?
Okay.
So when you're ready, I want you to go ahead and scoot forward for me towards the edge of the bed. Good. Now, I want you to lean over, and on the count of 3, we're going to stand up. 1, 2, 3. Good. Okay. So now, let's pivot over to the table. Now I have your hand here. Let's see. Let's shift our weight to the left, to the right. Good. Shift. Good. Shift. Good. Shift. Okay. Go ahead and place your hand here. Okay. So let's bring your arm out of this bent position and just kind of slowly, we're going to straighten this arm.
Fly right back up there.
It did, didn't it? It didn't want to stay straight.
No.
Let's see, we're going to spread those fingers for me, and yep, there we go. So you can bear some weight in this position, so this is good for this arm to stay straight and just kind of bear some weight. So you're going to stay in this position.
Okay.
So what we're going to work on is I want you to maintain and hold this standing position for me, and I'm going to be trying to move you out of it. And we're first going to work on going forwards and backwards, okay? So I want you to hold this position. Don't let me move you. Hold, hold, hold. Good. Now we're going to come the other way. Hold, hold, hold. Good. We're going to do this a couple of times. Hold this position. Good. Hold this position. Don't let me move you. Don't let me move you. Good. Hold this position. Good. Don't let me move you. Good. Hold, hold, hold. Good. Hold, hold, hold. Good. One more time. Hold this position. Good. Don't let me move you. Okay, good. Alright, you can relax. So how do you feel with that?
That's a little bit easier than what we just did.
A little bit easier. I can tell you that your standing balance is getting better since I've been working with you.
Yeah, it's come a long way.
You have. You're making great progress.
I want to get better though. I want to get to where I'm walking on my own. And
yes, we got to get you back in the class. That way you can be doing my job one day and treating patients.
Exactly. I want to ride my motorcycle again.
Well, hopefully we're going to get your strength and balance back up so you can be able to do the activities that you enjoy. Okay, so now what we're going to do is I'm going to be kind of pushing you from side to side, and I still want you to hold and maintain this position, okay? So kind of the same thing, but I'm going to be coming from different directions this time, okay? Are you ready?
Yep.
Okay, hold this position. Hold, hold, hold. Good. Don't let me move you. Good. Don't let me move you. Hold. Good. Hold this position. Good. Hold. Good. Don't let me move you. Good. Hold. A few more times. You're doing good. Hold. Good. Hold this position. You're doing great. Hold. Don't let me move you. Okay, good. Okay. How'd you feel with that?
I felt good.
Okay, well you did great. So now what we're going to do is we're going to get you back to the bed, okay? So if you want to go ahead, you can, I got you, give me your hand. Yep. Let's kind of shift our weight. Yep. Left and right, and we'll kind of pivot back towards the bed. And don't sit down until your knees touch the bed. Now let's reach for the bed and slowly kind of control that descent. Yep, okay. So now I'm going to go ahead and take this belt off of you, okay?
Okay.
Okay. And so what we're going to do is we're going to lay down on our right side, and I'm going to help with your legs, okay? 1, 2, 3. Good. Okay, good. Do you want your sheets covered back on you?
Yeah, it's kind of chilly in here.
Okay. Do you have any questions before I leave today?
Not that I can think of.
Okay. Well, I will see you again tomorrow, okay? Enjoy the rest of your day.
Thank you.
Thank you for working with me. You did a great job.
No problem.
Have a good day.
You too.